Good afternoon and welcome to the Emory Alzheimer's Disease Research Center's Weekly Wellness. This is a service, if you will, an educational service that we're providing for those of you who are interested in learning more about Alzheimer's and related dementias, but also learning about what kinds of resources may be available for those of you who are taking care of somebody with Alzheimer's or related disorder, or even if not Alzheimer's, any other chronic disease that requires much personal care and assistance. Today we have with us Stephanie Sutton, who is the founding expert of Stephanie Sutton, and what she does is help families, educate families about what kinds of options there are for senior living, for senior caregivers, and other needs of persons caring for persons over the age of 65. Welcome, Stephanie.
Thank you. Thank you for having me.
Can you tell us a little bit more about what kinds of services you provide? And when I say services, people always say they have a service. And a lot of our caregivers need services, but don't necessarily know what kinds of services they may need. So what will be most helpful to them is to know exactly what it is you offer, whether it costs anything, and how you can help them.
Sure. So we offer a free service to our clients, and basically we can help them narrow down senior living options, determine what is it that they need, whether it is senior housing, moving to a retirement community or assisted living, or maybe they need home care, or hospice, or respite care. As we talked about earlier, there are so many different options in the senior industry. They can be overwhelming to someone. So I kind of help them navigate through that, educate them on the options available based on what their needs are.
Okay, can you tell us a little bit about the difference when you say respite care? What do you mean by respite care?
Sure. So respite care is basically gives someone that's caring for a loved one, respite care allows them to have a break. Whether they go to a facility and they take their loved one to stay a few days, it could be for a week, it could be a matter of hours.
Mm-hmm.
Some of these assisted living communities offer day programs where essentially it's like a daycare for older adults, and they can go for a few hours.
Or
To have that
all
relief.
day?
Absolutely.
Okay. The other thing that is important for respite care, for those of us who are caregiving for persons with dementia is a cost estimated to be about $219 billion for caregivers. That's caregivers who are caring for somebody and not getting paid for it. So respite care allows you to get a break, as Stephanie mentioned, but there are other needs of caregivers. And so when you start talking about assisted living versus home care, can you kind of talk about what the differences are? I'm a very strong proponent of home care because people are in familiar surroundings getting the care that they need versus going to an assisted living facility where there are many more people and it's further away from people with whom they are most familiar. Can you kind of explain the difference between home care versus assisted living?
Sure.
And it's important to note that both in-home care and assisted living are not necessarily services that are covered by Medicare or health insurance.
That's right. So home care is bringing a caregiver into your home where you live. I will say, the average cost of home care is $20 an hour. And it can get very costly. The minimum number of hours is 2 to 3 hours per day. And if someone needed around-the-clock home care with a caregiver, it can get costly. So again, home care is going to be a caregiver coming in to your home and providing care to you, such as assistance with dressing, bathing, toileting, or just being a companion service.
What does that mean? What's
So
a companion service?
For someone to stay with your loved one and basically be their companion, to just sit with them and maybe enjoy time together, taking them to doctor's appointments, or just doing day-to-day activities with them.
To the beauty parlor or something?
Absolutely.
Okay. And how is that different from assisted living?
Sure.
What is assisted living?
So there are assisted living and personal care homes that are licensed facilities by the state that range anywhere from 4 beds to 300. And socialization is one aspect of assisted living, but people typically move there because they need a certain amount of care. It can be less expensive than home care, depending on the amount of hours of care that they need. But you get socialization with other residents in an assisted living community. You have your meals made for you. You have, housekeeping and laundry services provided. And then activities of daily living, meaning if they need a level of care service, that's offered to you, and you have 24-hour staffing.
And so when you say level of care, people may not understand that.
Okay.
My interpretation is people who can't feed themselves or dress themselves, who need additional help. Is that what you mean by that?
Well, there's a wide variety of care services offered, and every assisted living is different and offers different levels of care. So what I mean by that is someone may need minimal care, meaning just medication management services. They may also need assistance with just getting dressed in the morning, taking a shower, or just getting up and down the hall.
So what's the cost of assisted living?
Sure, the average cost is $3,100 a month.
Versus personal care, what's the difference between assisted living and personal care?
So there is a new license type that has come out as an assisted living, which allows facilities to provide an extended level of care. A personal care home, just as an example, when a resident becomes bedridden or they're no longer mobile, they cannot propel their own wheelchair or cannot bear weight, the state does not allow you to stay in a personal care home without applying for a waiver from the state.
Okay, but personal care homes are usually smaller than assisted livings, and
sometimes there are some large personal care homes, and then there's residential personal care homes. So a residential home would be a home like you or I are living in, someone licensed it through the state, and maybe they have 4 to 6 bedrooms, and they basically rent the rooms, but they have 24-hour staff, and they can be much less expensive and very family-oriented environment.
so how do you find out about personal care homes? Assisted livings are like the Arbor Terraces, the Sunrise. There's usually one in every large community, and they cost a lot more. But how do you find out about a personal care home?
Well, 2 ways. You can go onto the state website through the Department of Community Health, and you can find a list of every licensed personal care home in the state of Georgia. The other option would be to utilize a service like myself at Senior Advisory Services, where we can help navigate through the many options. There's over 400 licensed facilities in Georgia. So we really help you navigate would a smaller option be better? That's what's in your price point, depending on what someone can afford.
One of the questions that's come up from one of our viewers is, are these services available in Metro Atlanta, and are the services free? And so let's be clear, the services that Mrs. Stephanie Fiber Sutton is offering are personal advisory services to our family members. Those services are free, but obtaining home care service and assisted livings require an out-of-pocket expense for you. Can you kind of help them with that, please?
Absolutely. So again, just reiterating, my services are free to assist you and guide you in finding the right facility or type of home care or respite care. I can also educate you on what that cost would be at those facilities, and also educate you on the Medicaid options out there. There are personal care homes that accept Medicaid waivers, and there's home care companies that accept the Medicaid waiver program, which you just have to go through the application process.
So one of the questions that just came across is, how do you get to be a client of the Senior Advisory Services, your services? How does somebody get to you?
So you can call us, or you can inquire through our website, which is senioradvisoryservices.com, and that's S as in Sam, R, advisoryservices.com, or you can reach us at 404-512-5668.
Say that again.
404-512-5668, and basically we'll start with a telephone call, really just understanding what your needs are and to be able to help best guide you.
How are you different from the Alzheimer's Association?
Well, I think, they provide a lot of resources. My service is really educating you on the senior living options and home care services, what each facility, what is their business model, what type of care can they provide, and what would be best for your loved one.
Do we have a contract with local providers? I'm not really sure what that means, but tell me.
I think I may know what that means. So yes, our company has contracts or agreements with local providers.
Personal care homes, you
Yes,
mean?
personal care homes, assisted livings throughout the state of Georgia.
Okay, throughout the state of
Mhm.
Georgia. So if somebody is watching our weekly wellness and lives in Tifton, Georgia, you can help them.
Absolutely.
Or if they live in Rome.
Absolutely. And even if it's in another state, I've assisted families in many other states as well.
Okay. Do you make referrals? Do you make referrals?
Absolutely, I do. So again, my expertise are senior advisory services. Our expertise is around senior housing options and care. But whatever, we do make referrals, whether if someone needs a hospice company or home care, or maybe they're looking for a support group. So whatever the need is, it might be a financial planner, it might be funeral planning, we will guide them to, appropriate contacts.
Okay. A lot of our families caring for somebody with a chronic illness, particularly Alzheimer's, a lot of these people don't really have a primary care doctor. Do you help with things like primary care doctors?
Absolutely. So if someone needs a recommendation, we can do the research. If they end up moving into an assisted living community, a lot of those facilities have physicians that come on site to see the residents. If they're planning to stay in their home and just need recommendations of physicians, we can make that as well.
Thank you. I think some of the things that are important for our families is a certain amount of, my word would be case management. And it sounds almost like you do that. Is that appropriate?
I wouldn't call myself a case manager or care manager. So I do ongoing follow-up with my clients once they move into a property, just to continue to evaluate their satisfaction. But there are care managers out there that they get paid an hourly rate to basically do visits with a client in a community and follow their care plan and communicate with the family and physician.
Okay.
So that would be
that's
another
not the
service
same
I would
thing.
refer out.
So you're really more on the residential personal care side of things.
Yes.
Versus medical management
Right.
and all of that kind of
Right,
thing.
we definitely have the knowledge base around that and can make a referral to the appropriate source.
Okay, all right. Is there anything else you think people should know about your service and how maybe the Stephanie Fiber Sutton service is different from, let's not say the Alzheimer's Association, let's say something like a visiting nurse, home health care,
Sure.
because they have social workers who work with them. So how
Right.
are you different?
Again, we're different. Our service is completely free. I think what sets us apart is we'll serve anyone, no matter what their income is, no matter what your budget is. Again, there's options out there from $1,200 a month to $10,000 a month, and whatever your needs are, we will help get you to the appropriate source. And the second thing I really feel like makes us unique is just the knowledge base and experience that we have in the industry. I myself have been in senior living for over 15 years, and I've ran facilities and operated them and been in the shoes of the facilities and understand what goes on day to day. So that helps me better educate the families. And we take a personalized approach where we actually go with our families on the tours to these facilities, so we get to meet in person and build that relationship with them.
One of our viewers wants to know how you got started in this field. Are you a social worker? Are you a nurse? How did you get into advising and educating families about housing options and care options?
Sure. I started in the nursing home business. To answer your question, I'm not a social worker, but started in a nursing home doing admissions and marketing, and just kind of grown my career throughout the years of operating facilities. And, working for one facility and one particular brand didn't allow me to just help all the families in need by just moving them into one specific facility. So our services really is what I'm passionate about, is educating folks on the best option for them. Not one particular brand, but based on what their true needs are.
Okay, all right. If your services are free, how do you get paid for them?
Sure.
How do you?
So we get paid by the facilities. So when you decide to move your loved one into a facility, meaning the assisted living facilities, they pay us essentially a referral fee upon move-in.
Okay, all right. I think that one of the other questions is that what are the most frequently used services that you provide?
The most frequently used service is assisting families in crisis finding senior housing for them. So directing them to the appropriate assisted living, memory care facility, or retirement community is our main service.
You said crisis. Do you interface with the law community, like people who may be displaced for elder abuse or loss of homes? Do you work with agencies or county or agencies that help with that?
There's been a couple of clients that have been in that situation where I can direct to certain agencies that are appropriate.
Okay, all right, because that's a big thing. A lot of seniors do find themselves in situations where they are suddenly homeless,
Right.
Suddenly unable to reside in their own homes. Why is this special kind of advisory service needed by family? Oh, why do I think these services are needed? I think these services are needed by family members because they really don't know where to go. They don't know how to, let's say, access, is somebody really appropriate for an assisted living or a personal care home? Right. I'm a physician and I may see a family and it's clear that the relative that I'm caring for medically needs additional social assistance. And the families frequently aren't able to provide it. And in those instances, a lot of times family members need to be advised that this individual is no longer safe to live alone. And if they can't live alone, how can we get somebody to help them, whether we move them from their home or we move somebody in. So these kinds of services are important for doctors because doctors frequently see somebody who needs in-home support. Or most importantly, are no longer able to live on their own, independent of somebody else. And so Stephanie Fiber Sutton provides an option or somebody for you to call to kind of assist with that. And I think the demand for this service is going up. What is your viewpoint on that?
I think the demand for senior living is going up. The demand for services like mine are going up because the families that are out there and they are in crisis, whether mom or dad are in a hospital or a nursing home or living at home, they really need the guidance for someone to educate them on what to do next and what the options are.
When you talk about things like what to do next, one of the big things that we talk about is advanced directives and planning. Do you help with that, or can you see a need why families need to start looking at things like that?
Absolutely.
A lot of families have a lot of legal issues, but
absolutely.
Can you explain advanced care planning?
What I do with families is kind of go through, do they have the advanced directives, do they have power of attorney, which is really important. If your loved one has dementia, have you gone through the process to get power of attorney or guardianship? And we basically advise them and make referrals to an attorney that specializes in that service.
Okay. Is there something that you would like our readers to know about your service?
Call us no matter what your question is or what your need is and pertaining to anything around senior housing, senior living. And if it's not a service that we will provide, we will get you to the right resource.
Okay. What do you do if you can't afford care? And I guess when it comes to afford care, a lot of people may not have the resources to pay for either an assisted living, a personal care home, or in-home care. There used to be a program called SOURCE operated by the county. Is that program still available for people who don't have independent financial resources?
There is. So what I typically do is work with families depending on what the care needs are. There are income-based housing communities. At this point, some of them have a wait list. However, there are personal care homes that accept the SOURCE and CCSP program, which is a Medicaid waiver program. And there's also, nursing homes. Sometimes you get to a point where you just need to apply for long-term care Medicaid in a nursing home.
Long-term care Medicaid in a nursing home. But if somebody has, again, as Stephanie Fiber Sutton services are free of charge. So if you need assistance, she can probably help direct you to where you can get the kind of assistance that you need.
Absolutely.
Can you repeat the telephone number about how to access your service and what your website is?
Sure. So the phone number is 404-512-5668, and our website is www.S as in Sam, R as in Roger, advisoryservices.com.
Telephone number one more time.
404-512-5668.
I think we're just about at the end of our time, and I want to thank you so much, Ms. Viper Sutton, for coming
Thank you.
and
This is-
educating our viewers.
Thank
Thank
you
you
for
all
having
so
me.
much for tuning in to Weekly Wellness.
Thank you.